Hi, everyone. A quick note about the next few episodes. We wanted to create for you a consultation in progress that I could relay to you and you could hear the types of advice that I give to my patients. But because of HIPAA, we couldn't actually use a real patient. So you're going to hear real patient questions, but not a real patient. And we hope that this helps you get the information you need for an in-depth discussion of a patient's symptom or problem. You know, I see this all the time, and the mental health journey with cancer is its own journey, and it goes up and down. But at each stage, the oncology team is an expert in the things that you're going through, what you've been through before, what resources are available to help you, and how best to utilize those resources to give you the best possible quality of life. Cancer is just something that we all have to recognize, acknowledge, cope with, live with, struggle with, rage upon, crush, and even thrive with. This show is more than knowing and fighting or beating cancer. It's more than just relaying science, hope, and technology. Together, our purpose is to demystify cancer, take away as much fear out of the diagnosis, treatment, and process as we can, defeat its grip on our lives. This is The Cancering Show. You guys know I have a lot of help here in the studio for our cancering shows, and we spend a lot of time talking about if we could pick 3 symptoms that every cancer patient wonders about. Nausea seems obvious. Pain, always a question in the back of people's minds. But the one that I really wanted to spend as our 3rd episode on symptoms and coverage of symptoms, care of symptoms, is mental health. We know that your mental health underlies everything about your experience in life. It underlies your energy, your mental capacity, the ability to remember things and make decisions and concentrate, your sleep, even your ability to get out of bed in the morning and go do whatever it is that you need to do that day. And we know that cancer affects your mental health. Obviously, you're sitting in the doctor's office, the doctor says the word cancer, and it's just a gut punch. I still feel it right now if I could imagine myself in that situation. And unfortunately, that does not discriminate whether you are a physician, patient, nurse. Any person in that situation immediately experiences fear, anxiety, questioning. For some people, especially people with a history of struggles with mental health in the past, it can lead to feeling depressed or sad or even hopeless. And these are all issues that will affect not just how you live with cancer, how you are cancering, but it will affect your survival. There's even data to suggest that your caregivers' mental health could affect your long-term survival. And so we want to reach out to all of you as cancering patients, as cancering caregivers, anybody who wants to know more about the relationship between mental health and cancer, and get back to basics.
So, Dr. JYP, what do you even mean about mental health? What are we talking about?
Well, you know, I think talking about somebody's mental health is a really tricky thing. There are the external things that affect our mental health, the basics, like do we have enough food to eat, safe place to live, a roof over your head, that you are safe in your environment, that you're not living in an environment that might be dangerous to you, either mentally or physically, and that your needs are met. And for some people, that means having a purpose, having a job or something to do every day. And those are the external things that can affect your mental health. And then, of course, there's your internal mental health. For some people, they don't really think about their mental health that much. Things are pretty good most of the time. For other people, even when all those other needs are met, they struggle daily with anxiety or depression or other mental health disorders that come into play with a cancer diagnosis. And so we're actually talking about all of that and how it affects your cancer journey.
Of course I'm struggling with my mental health. I was just told I have cancer. But how do I know what's a normal amount of stress and what's abnormal?
So I think that's a really good point. The first thing that every patient says is, of course, I'm stressed. And the first thing we do as a cancer center, when you come into our cancer center, we have you meet with a navigator who reviews a distress scale with you. So they will talk about all those things that I mentioned, the internal stressors or any history, the external stressors that might be playing a role in your mental health, as well as any history of mental health problems or symptoms. We didn't mention that before, but symptoms that could play a role in feeling depressed. Or feeling like there's less reason to be hopeful because you are nauseous every day or in pain every day related to the cancer. So we assess all of those things, and then we'll help you to decide what is considered normal or not normal. But the main one from my perspective is if you are still able to live your life, choosing to go out and do things, able to get errands done, go to work if you have a job, and in general to make those connections with your friends and family. Instead, you're finding that you are too anxious to do those things, too anxious to concentrate, too anxious to sleep, or too depressed to do the things that you used to enjoy, too depressed to go out with friends, having crying jags. Anything that is preventing you from living the life you want to have is worth talking to somebody about.
Should that somebody be an oncologist or somebody else?
So I always say it always starts with us. From the moment of a cancer diagnosis, your oncologist and the team at the cancer center become the captain of the ship. Not to say that you don't already have a primary care provider who might have resources. Some patients actually have a relationship with a psychiatrist or a counselor when they come to the cancer center. But the oncology team is so well versed in that specific, unique combination of mental health and cancer that actually can be very combustible. And so when patients say, I don't know where to start, I always recommend that you start at the cancer center. Just as an example, at our cancer center, we have a counselor, a social worker, a navigator, and a chaplain available to meet with patients and review what specific distresses they might have and help them to come up with a plan or to mobilize resources that could help them.
What about connections between my depression and pain? Could depression be causing pain?
Yes, and pain can cause depression. It's a really tough cycle, and it's hard to know which one is which. And unfortunately, taking a lot of pain medicine can cause depression when it wasn't there before. So in those specific instances, sometimes we do recommend treating both in the hopes that both get better. And there are other ways to treat pain without narcotic pain medicine. And I'd refer you back to the previous episode on pain, that reducing your narcotic dose burden can help with depression in addition to many of the other things we talked about.
What are some red flags that I need to be watching out for in regard to mental health?
Some of the red flags that we see in the cancer center, we worry about patients who aren't showing up to appointments. And this is true for patients or caregivers. If either is struggling, the patient might miss an appointment or multiple appointments. We worry about people who are too tearful or too anxious. We worry about people who are very tearful or very anxious about their future, because anytime we are dealing with cancer and cancer treatment, we want you to feel hopeful. We want you to feel that there is an opportunity for life, for value, for decrease in suffering, and for a future. And we also watch out for patients who are isolating themselves. So not showing up to things that you used to do with your friends, regular bridge game, or normally walking your dog and not doing that anymore. And those changes in functionality that maybe even come with a cancer diagnosis or cancer treatment can lead to depression as well. And so it's that back and forth that exists that we want you to have the energy to do the things you want to do and to feel well enough to do them. The last thing I would say in terms of warning signs is sleep. That if you are not able to sleep, that should be a warning sign, because sleep is so important to your healing, so important to your treatment and its ability to work, your body's ability to fight the cancer, and ultimately to your mental health as well.
Is this a chicken or egg situation? What came first, the cancer or my mental health problem?
Yes and no. I think most of the time we think that the cancer came first, but of course people can come in with a history. But as to the question, can chronic depression or anxiety give a person cancer? The short answer is no. And yet, of course, we worry about the long-term biologic changes that occur for somebody under a chronic stress. The one that comes to mind here in the South is something like systemic racism and the differences that we see in survivorship between Black and white patients. And we know that's not necessarily a difference in treatment, but could be related to biologic changes that we see from the stress of racism and the chronic stress, elevated cortisol levels, increased anxiety that can lead to increased health problems in other ways.
When should I explore the idea of taking medication or talk to my doctor about taking it?
So the field of medication for mental health is so large that I don't think we can even cover it accurately here on the Cancering Show. And of course, this is a question we would defer to your healthcare provider, both your oncologist, which is important to ask them and speak with them about it, because they will have a better idea of you personally and how you're doing longitudinally. But also, if you have a relationship with a primary care doctor or a psychiatrist, they certainly will have an opinion. But the short version is, usually we tell folks to try other alternative therapies first, such as counseling, meditation, journaling, doing the things that help you to feel connected to your circle instead of disconnected. So being open about your diagnosis and making sure that you understand it's okay to ask for help from friends and family, probably people that you have helped through a serious event in the past. Being open and honest with your caregiver and making sure that they have support. So all of those things do help to alleviate some of the stress that goes with a cancer diagnosis and can help you to better understand if those things are going to work for you, if they are enough. And that, in my mind, really differentiates this is the acute stress of a cancer diagnosis, but otherwise I have a strong foundation, either in faith or family or other foundation, and a strong support system and a caregiver who is well supported and doing well. Most patients only need an added practice, such as meditation, journaling, gratitude practice, connection, to really find their footing and make it through the cancer treatment. For people who have a history of mental health diagnosis or who find that those additional things are not enough, that's when we wonder that maybe this isn't just the acute adjustment of a cancer disorder, but rather something more involved, like a generalized anxiety disorder or even a depression disorder, or both. And that treating that helps people to feel better faster, helps people to continue and complete their cancer treatments on time. And we know for people with one of those diagnoses that both the medication and counseling work faster and ultimately better than either one alone.
How can the Cancer Center help me connect with other people?
So our cancer center and a lot of cancer centers have a lot of great ways to connect with other patients. And those are usually through programs like a support group or a patient mentor. So if your diagnosis is more rare, that there is not a support group for your diagnosis, you can ask your physician if they know a patient who's been through this diagnosis before that maybe you could connect with. For patients who don't really have those options, online support groups are fantastic. And there are even generalized cancer support groups that still provide many of the same things. It doesn't necessarily have to be somebody who's having exactly the same chemotherapy. Similarly, there are resources for caregivers. There are caregiver support groups, online resources for caregivers, and we always encourage you to seek out those extra relationships, people who've been there before. It is incredible what that can do in terms of feeling heard, feeling like you're not the only person who's been through, having someone who's been through this before and can kind of show you the way as a patient in the way that even your oncologist can't really give you. And we hope that the Cancering Show and resources like it can help to give you a roadmap and alleviate some of that stress, just that increase in knowledge. And if there's a way that we can connect you to other folks in your cancering community, we'd love to try.
So, Dr. Pierce, I have a friend who finished cancer treatment, and she swears that she's worse off emotionally now than she was during the treatment. Does that make sense?
You know, I see this all the time, and the mental health journey with cancer is its own journey, and it goes up and down. For patients on that initial treatment journey, there is a fight or flight response. You know, your adrenaline kicks in, you surround yourself with your army of people to help, and you are on a mission to get to ringing that bell or finishing that treatment. And, you know, we talked about this in an earlier episode, and I'd refer you to episode 12, Fear, Anxiety, and the Chasing Tiger. And I talked with Dr. Franks in that episode about the fact that for many patients in survivorship, especially early on in survivorship, there's almost a PTSD response, this constant fear or anxiety about the cancer coming back. And it can have the exact same symptoms as somebody experiencing PTSD, which can be really very different from the acute stress of a cancer diagnosis, getting to treatments on time, the burden that it puts on you either financially or at work or both, and all of the things that go into it. And for some patients, unfortunately, there is a third part of this journey, which is the depression that comes with recurrence. And how do we treat that? How do we learn to live with hope and joy and love and gratitude in recurrence, particularly if it's a recurrence that does not carry the hope of a cure, but rather the hope that you can live as long as possible and as well as possible until that is not possible. And that's really hard. There's a lot of hard in cancer and the mental health journey. But at each stage, the oncology team is an expert in the things that you're going through, what you've been through before, what resources are available to help you, and how best to utilize those resources to give you the best possible quality of life. I really hope you liked our symptoms and side effects series. This is new for us, as most of you know, to do something that's very specific, drilled down medical advice, even though for most of you cancering out there, you are not my patients. But I hope that it is advice that can be useful to you to use the medications that your doctor may have prescribed to help those symptoms and side effects. And also for that mental health episode to know that what you're experiencing is normal and that you're not alone and that it's okay to ask your oncology team for help. And I hope you'll get something out of these episodes more than that. I know I will, because I'm excited to refer my patients to these episodes where they get to hear that advice more in depth and over a longer period of time and refer back to it if there's something that they miss. We are going to do more of these episodes, but we are super excited to get back to the great stories, experts, and information about new treatments that keep you coming back to the Cancering Show. So between now and then, keep cancering and take care of yourself. Again, thanks for listening to the Cancering Show. And don't forget to submit your questions at cancering.com. We're here for all of those questions and we'll get you the answers. This show is brought to you by the USA Health Mitchell Cancer Institute. MCI is a leading-edge cancer research and treatment center built to fight cancer in Mobile and Baldwin County. Our researchers and clinicians focus daily on the struggle against cancer, serving a potential catchment area of more than 4.1 million people, with a singular focus of advancing cancer diagnosis, treatment, and prevention throughout the Gulf Coast and beyond. with science, technology, and hope. Want to know more about the Mitchell Cancer Institute? Visit us at usamci.com or find us on Facebook, Twitter, and Instagram. The Mitchell Cancer Institute is a member of USA Health, the health system for the University of South Alabama. To learn more about all of our hospitals, clinics, and services, visit usahealthsystem.com.